I am Mr. Dhayaanandh from Neuroscience Department, Assistant Professor cum Neuroscience Technologist, Department of Neuroscience Technology, Yenepoya School of Allied Health Science. So today we will be seeing about Parkinson's disorder. So these are the specific learning objectives that the students will be able to learn, and at the end of the session the students will be able to define Parkinson's disorder and describe the etiology, pathology, clinical features, diagnosis and the treatment of Parkinson's disorder. So first, what is Parkinson's disorder? So basically it is a progressive neurodegenerative disorder that primarily affects movement. That is, the patient will be having rigidity, tremor, such things of symptoms. So it is characterized by gradual loss of dopamine producing neurons in the region of the brain called the substantia nigra, which is basically located in your basal ganglia. So it is characterized by the gradual loss of dopamine producing neurons in the region of the brain called the substantia nigra. The substantia nigra is located in the basal ganglia where the dopamine is produced. So the dopamine is a neurotransmitter that plays a key role in transmitting signals within the brain to produce smooth and coordinated muscle movements. So when this dopamine level gets affected, your coordinated muscle movements will be also affected, and which will cause your rigidity and your slowness of movements. So here we can see that the basal ganglia, in that putamen caudate nucleus and the substantia nigra which is located just below that, which will be having your dopaminergic pathway. So when this dopamine is affected, you will be having symptoms like rigidity, tremor, bradykinesia, postural instability. In this, the bradykinesia is where you will be having slowness in movements, tremor is where there will be shaking of hands, rigidity and then postural instability. So when we are coming to the etiology, how the Parkinson's disease is caused, mostly the cause of the Parkinson's disease is unknown. So the gene mutation that has been identified which may cause Parkinson's disorder are synuclein, Parkin and LRRK2. The observation that 1-methyl-4-phenyl 1,2,3,6 tetrahydropyridine meprodin analog produces Parkinson's disease in humans and animals. So this meprodin analog has been observed in patients with Parkinson's disorder, which may have the cause of Parkinson's disorder symptoms. The accumulation of misfolded alpha-synuclein protein into the Lewy bodies is a hallmark of Parkinson's disease. So these aggregates are toxic to neurons and disrupt the normal cellular functions. So when this Lewy bodies is nothing but the abnormal protein clumps that are found in your neurons. So these will disrupt the production of dopamine, which will cause the bad disbalance in your coordination. So the loss of dopamine producing neurons in the substantia nigra, a region of the brain, leads to the motor symptoms of PD. So dopamine is crucial for regulating movement. Pathology. The substantia nigra contains pigmented cells which give it a characteristic black appearance macroscopically, which is known as neuromelanin. So these cells are lost in Parkinson's disease. The substantia nigra becomes pale. So these pigmented cells give it a dark grayish color. So when in Parkinson's disease these cells are lost, the substantia nigra will become pale in color. So the remaining cells contain atypical eosinophilic inclusion Lewy bodies. So these Lewy bodies may be found in cerebral cortex, especially when dementia is present. So in this picture you will be able to see the basal ganglia. In this, when you are seeing near the substantia nigra, it is having a dark shade in color. So when this is affected with Parkinson's disorder, which is a neurodegenerative disease, these cells tends to get degenerated and becomes pale in color. Here you can see that the pars compacta and pars reticulata, which is present in the substantia nigra, becomes pale in color. So diminished substantia nigra as seen in Parkinson's disorder. You can see in the picture the difference between the normal substantia nigra and your affected substantia nigra, which is in Parkinson's disease. So, Lewy bodies. The Lewy bodies are abnormal protein clumps that form inside the nerve cell in people with Parkinson's disease. These deposits, called Lewy bodies, affect chemicals in the brain whose changes in turn can lead to problems with thinking, movement, behavior, and mood. So, these Lewy bodies will basically affect your thinking, movement, behavior, and mood. So, when these are present in your nerve cells, they tend to cause Parkinson's disease. So, the clinical features or the symptoms of Parkinson's are mask-like expressionless face with drooling, because they are having bradykinesia and they will not be able to have a expressionful face. So, they will be having an expressionless face. Pill rolling, tremors of hand, shuffling gait, rigidity, and bradykinesia. So, shuffling of gait is where the walking of the patient will be not in a normal way. They will be having shuffling of foot in front of each other in Parkinson's disease. Raising from a chair becomes laborious. Even eye movements may be affected with loss of ocular convergence and upward gaze. Excessive sweating and greasy skin, which is also known as seborrhea, it may also be present. Autonomic features, postural hypotension, constipation, these are all some of the other symptoms that can be present in Parkinson's disease. So, REM sleep behavior disorder, it is where the patient acts out dreams and may hurt themselves or their sleeping partners. So, in this picture you can see that this REM sleep disorder, where the patient is acting out his dreams, like whatever dream he is having, he will be able to act it out. And then in seborrhea you can see the excessive sweating, oily skin and all. And this is your postural hypotension, where sudden change in posture can cause hypotension and dizziness of the patient. So, mimics are some of the other diseases that can be similar to Parkinson's disease, which can be often misdiagnosed as Parkinson's. So, multiple system atrophy, progressive supranuclear palsy, cortico-basal ganglionic degeneration, diffuse Lewy body disease. Multiple system atrophy, it is where there will be miscoordination in the patient and they will be having tendency to have a frequent fall. And progressive supranuclear palsy also has symptoms that are similar to Parkinson's. Cortico-basal ganglionic degeneration is where there will be degeneration in your cortex and the basal ganglia, which will be similar to Parkinson's disease. Diagnosis include functional imaging SPECT and PET scan. So, SPECT is where it is known as single photon emission computed tomography, and PET is known as positron emission tomography. So, these tests can be used to detect Parkinson's disease in patients. Next comes your treatment. So, in treatment, levodopa and dopamine agonists are given, which will increase your dopamine levels and it will increase your stability of movements. COMT inhibitors, catechol O-methyl transferase inhibitors, used as adjacent therapy in systematic management of idiopathic Parkinson's disease. Amantadine is an anti-dyskinetic medicine which will help in the aiding of recovering from Parkinson's disorder. Deep brain stimulations, which can also be given to help the patient, and human fetal and medullary transplantation is also done in Parkinson's disorder for the patient to recover from Parkinson's disease. So, the summary is Parkinson's disorder is a progressive neurodegenerative disorder that primarily affects movements, and in etiology we have seen that it is not a definite cause has been known, that but gene mutation has been identified. Pathology in Parkinson's disorder, it includes substantia nigra, where the cells become pale and the dopaminergic neurons are lost, so that you will be having coordination movement disorders. So, clinical features is where masking of face will be there, pill rolling tremors, shuffling gait, rigidity and bradykinesia. This is an overall view of Parkinson's disorder. So, these are the references that I got my notes, and thank you.